Hello, good morning and good evening, wherever you are. This is Kira from University of Southern California. It is wonderful to see all of you today here. And welcome to UIC graduate program events, which are serious webinars devoting to spread cutting-edge knowledge and insights in different industry and areas. This is the 112th UIC event. We're excited to present you a wonderful webinar about public health data science. Featuring Dr. Trevor Pickering and Corinne Smith, today's webinar will help to navigate your future through exploring career pathways and unleashing potential in public health data science. So welcome Dr. Trevor Pickering, the director of the MS in Public Health Data Science program, assistant professor of clinical population and public health sciences at Keck School of Medicine of USC. Welcome. And welcome Corinne Smith, the Student Service Advisor of MS programs in Biostatistics and Epidemiology of Department of Population and Public Health Sciences at Keck School of Medicine of USC. We are really lucky and grateful to have them with us today. And dear audiences, please know that we will have about 15 minutes Q&A section after the speech. Feel free to type your questions into the chat box. We will try to get as many questions as we can at the end of speech. And kindly remind for Zoom audiences that this webinar will be recorded. So please mute yourself. Thanks for your cooperation. Okay, now everyone, please join me in welcoming Dr. Trevor Pickering and Corinne Smith. And next, I will turn it over to Dr. Pickering. Thank you.
Thank you.
Hey, everybody. It's so good to be here with you today to talk about data science, especially data science at USC. It's a relatively new field and a new master's degree program for us. And so I'm really happy to get the word out so that everybody can know about what this degree is and what you can do with this degree if you're a student here and graduate from our program. So first up, I wanted to talk about the program leadership and staff. We were already introduced to me. I'm Trevor Pickering. I'm the director of both the Data Science Master's Degree Program and our Biostatistics Master's Degree Program. We also have Corinne Smith, Student Services Advisor. If you email our department, there's a good chance that Corinne might respond to your Student Services email. We also have Laura Sims, who also might respond to one of your emails. She's an administrative assistant for us. So if you're looking into our program, one of us will probably be helping you at some point. Somebody else on our team today that probably won't be helping you is Leon right here. This is my dog, and if you hear somebody barking, it's most likely going to be him, just to give you a heads up for that. So we're talking about data science, and I think the biggest question that we can answer right now is what exactly is data science? Data science, a lot of people don't really know exactly how to define it, but there's a consensus that it contains 4 big pillars of content. The first pillar of data science is knowledge of math and statistics. So knowing about maybe a little bit of biostatistical methods, knowing how to do machine learning, maybe some artificial intelligence, and just a variety of statistical modeling techniques. The next pillar of what makes a data scientist is having knowledge of computer science. This could be computing packages such as R and Python, which are both used in our program, knowledge of databases and database systems like SQL and NoSQL, and other big data technologies. Also, data scientists need to have domain knowledge. This is the area of expertise in which you will apply all of the knowledge of data science that you have. So you'll see there's a lot of different flavors of data science out there. Even within USC, we have a lot of different types of data science programs. We have an exercise data science program that's being built right now. The Viterbi School of Engineering has a healthcare data science program. Lots of different data science programs. The one from our department specializes in public health. So having domain knowledge means that you're also hopefully passionate about these skills and being able to apply these skills. In the case of public health, to making populations of people healthier, help with diagnosis, treatment of disease, and things of that nature. Also, it helps if you're a curious type of person and a problem solver, because that will lead you to developing more domain knowledge. And then finally, the fourth pillar of data scientists is communication. Being able to analyze data is great, but then also developing the skills that you need in order to express what you have analyzed is important as well. So as a data scientist, you would be drawing insights from data, but then also presenting them to the stakeholders. People aren't going to know what computer output means, at least people that you're going to be working with higher up that want to know these insights. So you are going to be interpreting the outputs into information that they can actually use. Writing reports, giving presentations, and maybe creating visualizations of results. So these all come together in this kind of puzzle right here to describe what a data scientist actually is. The outlook for data scientists in the next 10 years is pretty good. It's been said that demand, depending on which source you cite, demand for data scientists is expected to increase anywhere from 15 to 36% between now and 2031. So the jobs will be out there. Also, depending on which source you look at, the average US salary for data scientists range anywhere from $113,000 to $138,000. And the areas in the United States, at least, with the most data scientists include the New York metropolitan area, the San Francisco Bay Area, Los Angeles, where our department is housed, Washington, DC, Chicago, Dallas, San Jose, Atlanta, Philadelphia, and Seattle. All areas where there's a large concentration of data scientists. You might be wondering what a career path is for a typical data scientist. This is taken from a book called Everything You Should Already Know About Data Science. And it starts off right here with a distinction between a data analyst at the bottom down here and a data scientist. Data analysts typically analyze data and present their results, whereas a data scientist has a bigger picture of how database systems work, how to leverage data, how to use data, and just an overall deeper knowledge of data. After starting out as a data scientist, you might work your way up as far as data scientists go at a company until you become lead data scientist right here. And then you can make a decision about whether you want to go toward a more technical side, which would be climbing the ladder up to chief data scientist, where you'd continue to apply your skills in data analysis and database systems, or if you were going to go toward a more strategic role. If you were here, your role would be a little bit more administrative in setting the vision for how data science can be used within a particular company, a little bit more managerial in nature. Both ways, though, are excellent options as far as integrating your knowledge of data science within a company and providing a meaningful impact for that particular company. We've talked about data science generally, but our degree program is public health data science. So there is an article by Goldsmith and others in 2021 that talks about what does data science in public health actually mean. And in this article, they said that public health data science is the study of formulating and rigorously answering questions in order to advance health and well-being using a data-centric process that emphasizes clarity, reproducibility, effective communication, and ethical practices. So pretty much what we talked about before, creating analyses that provide insights into problems that need to be solved. Another interesting quote, though, from that article is that they say that individuals who identify as a public health data scientist often do so as a secondary discipline, but they have a primary expertise in epidemiology, biostatistics, health policy, environmental health, or another area. And the reason this is so interesting to me is because if you're coming into our program of public health data science, you're going to be in a department that has other different divisions. And within our department, we have a division of epidemiology, we have a division of biostatistics, we have a division that sets and studies health policy, we have an environmental health division, we have a health behavior division. All of these divisions that were talked about within this particular paper here, we have in our department. And as a student in our department, you can collaborate with these faculty, you can work on research problems in those areas. So it's a great opportunity that will exist for you within this particular program. If you still are kind of on the fence about what could I do with a degree in public health data science, here are some concrete examples of things that you can study with this particular degree. So I give 4 examples in this particular slide. The first one talks about describing current cancer diagnosis trajectories in communities. So is cancer increasing? Is cancer decreasing? Are there seasonal effects? Do cancer rates change after a particular health policy is implemented? So describing cancer diagnosis trajectories and forecasting predicted trajectories. This is something that has been studied within our department. The next example is analyzing and mapping risk factors geographically and leveraging that information to develop public policy. With the COVID pandemic, there has been in the United States a lot of talk about vaccine hesitancy, people not wanting to have the COVID vaccine and what we can do about that. And then also whether the vaccine is reaching communities that are at risk. One of the potential projects that has been looked at is looking at geographically, what are these trends of vaccine rates? And then what can we do in order to increase vaccine rates? We could look at modeling the spread of infectious diseases through communities and in predicting the long-term impacts of these illnesses. So looking at how certain diseases like monkeypox spread, how does COVID spread, how does different all sorts of different diseases spread through communities, and then looking at how does that affect these communities. And then finally, something that I've helped work with a little bit is developing algorithms to help with medical diagnoses through either blood lab work or imaging or other means. So if we look at a particular output from radiology, can we apply machine learning in order to gain more insights that couldn't already be gained through just a visual examination? So a lot of different types of projects that can be looked at with a degree in public health data science. That said, if you're thinking about public health data science, the next question would be, well, why USC? USC, University of Southern California, is one of the world's largest private research universities. In fact, in 2017, they were named number 3 as far as top universities in the West of the United States. In 2019, they were named top 100 most innovative universities. And we were also named number 27 as far as best universities within the United States. One of the things that our department is really proud of is that as far as public health departments go, we are number 2 in funding from the United States National Institutes of Health as far as public health departments go. So our department in particular, the Department of Population and Public Health Studies, is able to draw in a large amount of research funding, and that extends to more opportunities for research, more staff being funded, things of that nature. USC has an expansive alumni network. Over half of our 450,000 plus living alumni reside in California, and you can find our alumni in leadership positions worldwide. For those that don't know, this is a picture of Will Ferrell, the actor who graduated from USC. Other notable figures graduated from USC. George Lucas from film fame graduated from USC. Our alumni are all over the world, and they get alumni perks like frequent events, career services for life, volunteer and travel opportunities, ways to stay connected online, regional alumni events, meetup groups, discounts on financial services, travel, and more. So a really powerful alumni network at USC. The University of Southern California has more than one campus. The two biggest campuses at USC are the University Park campus, which is also considered the main campus where a lot of our departments are housed. This has the traditional college feel to it. Beautiful brick buildings, a lot of undergraduate students, graduate programs, engineering, film, all of those departments are housed at the University Park campus. The campus where our department is located is at the Health Science campus, which is about 10 miles away from the University Park campus. Our campus is located at the Keck Hospital at Los Angeles County USC Public Hospital, and it has a more professional vibe. You won't see a lot of student clubs and undergraduates walking around. It's going to be more doctors, nurses at our particular campus. We can see a map here how separated these two particular campuses are. Even though they are separated, there are shuttles that run between the two, and it's not too difficult to get from one campus to the other. But if you think about the Los Angeles Memorial Coliseum down here in the corner, that is at the University Park campus, and you can see the size of the University Park campus. But our particular health science campus is located up here in the top right of the map, and they're separated by downtown Los Angeles here in the middle. Our department is at the Health Science campus, and it is under the umbrella of the Keck School of Medicine of USC, which has an established reputation as a medical school. It was founded in 1885 as a county hospital medical school and is one of the oldest, it is the oldest medical school in California. The Keck School of Medicine is also a leader in research. It has 23 academic departments, more than 30 research centers. It's in the top 25 medical schools for federally sponsored research. And you can find things at the Keck School of Medicine like state-of-the-art equipment, research space, support staff, grant application support, and more. So the Keck School of Medicine has a big infrastructure for supporting medical research. Our Department of Population and Public Health Sciences is located within the Keck School of Medicine. It was founded in 1977, originally as the Department of Preventive Medicine, and originally doing research in cancer epidemiology. But ever since then, the different domains of research that we do has expanded, and we've grown to having now more than 100 full-time faculty. You'll find research areas that you can apply your data science degree on in topics such as cancer epidemiology, biostatistics, bioinformatics, environmental health, global health, health behavior, health policy, and community health. So really giving you that context in which to apply a data-focused degree. Our faculty within the department are award-winning scholars and teachers. And I see right here on this slide, on the left, we have Tom Valente. He does a lot of research on social network analysis within public health. He wrote several books on social network analysis and health. So the people that you'll be working with as professors are leaders in their field that have been recognized for teaching and scholarship. Our department has nationally funded researchers with lots of publications in top scientific journals, and our faculty are leaders in their field that are involved in the larger academic community. And the benefit of that is that you can draw on this experience and expertise that our faculty have. We have a wide array of expertise in areas such as statistical methodology and genetics, environmental applications like pollution, and things such as clinical trials. And lots of our faculty have active labs and work with large databases. Now I want to talk about the student body of the health, the public health data science program. This is a new program. It was actually implemented in fall 2020. So we only have a couple of graduating classes so far. And because of that, the program is relatively small, meaning that if you're in this program, you will get individualized attention. Our incoming cohort of students is typically 5 to 10 individuals, and class sizes in the program range from approximately 5 to 25 students. Our program has about 50-50 male to female ratio, and about half of our students are international, and primarily our international students are from Asia. This slide talks about your progression through the program. On the left, we have what we would recommend for preparation as far as applying to the program. In the center, we have the types of topics that you will learn in the program. And on the right, we have what you will be able to do as far as career opportunities after the program. So for those applying to the Public Health Data Science program, we do require that they have a 4-year bachelor's degree or equivalent. We would like to see that they have quantitative training, especially in calculus and linear algebra. It's great if you have some programming experience. Our program mostly uses R, but with a little bit of Python. And then since it's an accelerated program, we would like you to have knowledge through intermediate statistics. So topics such as t-tests and ANOVA, maybe some correlation or regression analysis. So that's previous preparation that we would recommend for the program. While you are in the program, you'll learn the following: statistics and statistical theory, how to analyze data, how to implement regression analyses, how to use programs such as GitHub and R, reproducible research, version control through GitHub. You'll learn machine learning and have the opportunity to learn about neural networks and deep learning. You learn about databases and database systems, and you will choose a public health specialization. So this is a class where you will gain public health knowledge, and it's very flexible as far as which class you can choose for that. Previous graduates from our department, our data science program is new, so we don't have a lot of information on their careers. But within biostatistics and epidemiology, we've seen that our graduates have gone on to companies in biotech like Amgen, Novo Nordisk, have gone on to healthcare like working for Kaiser Permanente, Novartis, hospitals such as City of Hope Cancer Center and Cedars-Sinai. We've had people move on to big tech like Google and Amazon. And then we have people that stay within academia working in research and at universities. Our curriculum provides a combination of skills in public health and in computing. So on the left, you can see that we have some examples of classes that you can choose for your public health requirement. This is not limited to just these classes. There are more, and I encourage you to look at our program's webpage to see all the different classes you can take as far as your public health requirement. But you can choose to go into health policy, you can choose to go into epidemiology, clinical studies, biomedical informatics, neural networks, deep learning. These are all public health areas that you can take classes in. In the program, you're also required to take a computing requirement. This particular class is taken not within our department, but at the Viterbi School of Engineering at USC. And you'll learn more about data science, computer science, database systems, things like that through their computing requirement. So again, not an exhaustive list, but you could take classes such as database systems, artificial intelligence, analysis of algorithms, data mining, things of that nature. The middle of this diagram shows our core courses. This program has 4 core courses that combine public health and computer science / data science. The 4 core courses in this program are the Introduction to Health Data Science course, Machine Learning for the Health Sciences, Regression Analysis for Health Data Science, and then an Introduction to Probability and Statistics for the Health Sciences course. When in this program, a typical student takes about 2 to 3 classes per semester. In order to be considered full-time, you have to take at least 8 units, which is 2 classes, and I would recommend no more than 12 units or 3 classes per semester. It's an accelerated degree program. Our Master's in Public Health program is at least 40 units. Our Biostatistics program is 39 units, but our Public Health Data Science program is 32 units. So it is a quick program that it's designed to be completed in 4 semesters. So if you start in the fall, then you're expected to graduate at the end of the fall semester the following year. And that's because you will take classes in the fall, spring, summer, and then the next fall. That's not to say that you have to complete it in that short of time, but the program is designed where it could be completed in that short of time, should you choose. And then the culminating experience of the program is the practicum. This is a course where you will spend the entire semester over the summer after your first year working on an applied data science project. You will get a project topic. In the past couple of years, we've been working on a cancer research program through City of Hope, where people from outside of our university come in with a research question that they give to the class, and then the class applies their combined knowledge that's been acquired through the program in order to tackle that particular research question, and not only just analyze it, but present the results to the people at City of Hope. So it takes all of the skills that you've learned and gives you a forum in which to practice and apply those skills in a real life setting. We've asked our graduating students to talk about what they've liked about the program, and here are a couple quotes that I wanted to share with you. One student said that you have a wide range of relationships with many departments at the Keck School of Medicine. It seemed like a no-brainer to use the resources at the health science campus to further my understanding of data science as it pertains to public health. So we're not just learning data science in this program, we are learning how to apply it to different areas within medicine. And another student said that the defining factor for them was being able to be involved in a lab with a professor's research. Our PhD students would present their research, and I like that faculty from outside universities presented their research as well. So we're located in an environment that has a lot of research going on. And as far as where our students have gone, students from the class of 2021 have become a research program manager at St. John's Cancer Institute. One student became an associate scientist at PTC Therapeutics, and another student stayed at USC and became a programmer analyst. From the class of 2022, one student became a software development engineer at Yahoo. 2 other students stayed at USC, one to become a research programmer and one to become a biostatistician. And another one of our students became a data scientist at Genentech. So our students are being placed both within USC and in companies outside USC upon graduation. And I told you that Leon was another member of our team here. There's a picture of Leon. And Leon is encouraging you to apply to our program. Our fall admission cycle will open for admissions starting on August 17th. So you can apply as early as a little under a month from now. Our priority deadline is December 1st. And our regular deadline is April 1st. And if you apply for the priority deadline, then you're eligible to receive scholarship consideration and you'll get your admissions decision early. The requirements to apply are to send us your official transcripts, to send 3 letters of recommendation, send us a statement of purpose talking about why you're interested in data science and why you want to pursue a program at the University of Southern California, a CV or a resume, IELTS or TOEFL scores. And students typically ask if they need to submit their GRE scores, but the GRE is not required for our program. The link to apply is at SOPHIS, Schools of Public Health Admissions System, I think is the meaning of that. So if you want to apply for a program, go to sophis.org. I really encourage you to visit our department's website. You can find a lot of useful information about all of our department's programs through that website, about admissions requirements. We go over them in that particular website, about research that's being done within our department, about the requirements for the program, the curriculum, classes, all of that can be viewed through our department's website. And if you have any questions and want to talk to one of us, you can contact our department's admissions teams for questions through this link right here. PPHS admissions at usc.edu. And PPHS stands for Population and Public Health Sciences. So thank you. It's been great being able to talk to you and share my passion for data science, especially at USC within our department. And Corinne and I look forward to any questions that you might have.
Thank you, Dr. Pickering. Thanks so much for giving this excellent presentation and giving us a full picture about public health data science, along with a promising and expensive future in the market. Okay, next will be our Q&A part, and we already got some questions, both from Zoom and live streaming platforms. Okay, let's take the Zoom question first. The question from Tony. Thanks, Professor, for this very immersive session. Any guidance or insights you can provide about the journey towards a PhD after completing your master's degree would be great appreciated. Thank you.
That's a great question. There are opportunities to pursue a PhD both within our department and at other institutions. I would say that we should take this on a case-by-case basis. So if you are interested in pursuing a PhD, let us know when you come into the program. We have a particular trajectory of classes that we can put you on. So for example, a lot of students that apply to the program typically don't want to pursue a PhD. They want to get into the workforce right away. And our curriculum is designed to allow that to happen. But if you want a little bit more rigorous training within data science and theory, maybe statistical theory, we can look at your course schedule and maybe provide some classes that will help you reach those goals. Maybe that's taking some PhD level classes while you're in the program, which will make you a little bit more competitive when you're applying to PhD programs.
Thank you so much, Doctor. Okay, I got some questions from live streaming platforms. The first question. Hi, Professor, you just mentioned that we could choose a select course from CS department. That's really great. And the audiences would like to know if the CS courses are too competitive to select. They are really worried about the space.
The Viterbi School of Engineering reserves their courses for their own students first, but since our program requires that they take a class from Viterbi, our students are included in that pool that have a reservation for enrolling in classes. So our students will be able to sign up for those classes before the remainder of the university is able to. Is that right, Corinne?
Yes.
Yeah.
Our students do have priority registration along with the Viterbi students.
Wow, that's really cool. That's really great news to our students. Okay. Okay, the next question. Hi, Professor. You just mentioned that there will be a semester-long practicum with a project. Would you mind to elaborate what kind of project it is? And do students have any chances to interact with industry professionals during the practicum? Thank you.
Yes, you do have that opportunity. Our practicum, I can't say what the practicum will be the year that you take it, if you are in a program, because it potentially can change from year to year. But our goal with the practicum is to have it be something from outside the university. And the reason for that is to get students used to how things are in a different type of work environment. If you've been taking classes within our university the entire time, you know how we do things. But when we bring somebody in from the outside, they might have a different way of talking about things, different ways of storing their data, interfacing with data, different types of questions they ask. And we think that that's really valuable for our students. So we will have somebody from outside the university, either at a different research institution or at a different company that will be providing the practicum. Yeah.
Okay, thank you. We got another question from Zoom regarding the courses from Victoria School. The student asked, will students choose from computer science or any other departments for the elective course?
That's another situation that I would take on a case-by-case basis. Only courses from the Viterbi School of Engineering have been approved for our computing requirement, but if there was a compelling reason that a student wanted to take a course from a different department, we could evaluate that at the time. Our curriculum we've been working on, it's become more flexible in the past year, where if you want to take maybe a little bit more of a heavy computer science load, you're able to do that through the computing requirement and through electives. If you don't want as much computer science and you want some more public health training, you can do that too. So there's flexibility as far as the classes you take, especially when we're thinking about the electives that you can take.
Thank you, Professor. And the last question from Zoom. Hi, Professor. Would you mind to elaborate a bit more of how can we be qualified for the scholarships for your program?
The people that our admissions team chooses for scholarships are people that have demonstrated excellence in a range of areas. They typically have research experience. They've shown themselves to be independent researchers. They have good grades, they have good recommendation letters. So there's nothing in particular that you can do specifically in order to be qualified for a scholarship, but I would say just have a good record of being a productive student, getting good grades, and then having good recommendations.
Thank you, Doctor. Okay, thank you, Corinne. Dear audience says you could locate our list courses in our chat. Thank you. Yeah, I got one more question from live streaming platforms from our potential student, I think. Hi, Professor, I'm really interested in public health data science and I will graduate this December. So do we have spring intake for next year?
We currently don't have spring admissions. This is on this slide, you can see application deadlines. This is the application deadline for our other programs like biostatistics and applied biostatistics and epidemiology. When we're talking about our public health data science program, currently, we only admit for the fall semester. That's not to say that that won't change in the future, but right now the program is only admitting for the fall.
Okay, thank you. And another question regarding our courses. Hi, Professor, would you please give some examples or course description to elaborate how this major to help to polish students' skills on dealing with the data to solve the questions in public health area?
I would say that it's difficult to pinpoint anything specific. All of the courses are designed for that. So the courses on like regression analysis, the course on introduction to public health data science, it's using data science in the context of public health. So the examples from the course, the types of data that you'll use in these courses is all public health oriented. So the entire way you'll be using, learning about and using methods within public health.
Okay, thank you. Yeah, we got another question from Tony. I think Tony is real interested in our program. Hello, Professor. I know that the engineer school offers a similar program to yours. How is your program different from the Viterbi one?
There's a couple of different ways that the Viterbi program is different than ours. Most of our courses are going to be from our department. So the core courses in machine learning, regression analysis, and data science are all going to have a public health focus. When taking those through Viterbi, they're going to have a more general focus, not particularly applied in one domain, I would say. Another thing that I've noticed about our program is that we do provide students with a little bit more training in biostatistics, both applied biostatistics and biostatistical theory than other data science degree programs do. So in the Viterbi program, you won't be required to take a class, say, on statistical theory, whereas you will have to take a statistical theory course in our department. I think that's primarily because you can see that our department has a lot of degree programs within biostatistics. So yeah, the focus on public health, first of all, is one of the differences, and the second one is the slightly more emphasis on statistical theory and applications.
Okay, thank you, Doctor. And we got another question from Ellie Young from Zoom. My major is economics. I don't have any programming courses, but I learned statistics, calculus, and some basic courses about computer. Do you think I'm qualified for your program for academic side? Thank you.
Yeah, the reason that we have these requirements is because we want students to be successful when they start the program. And when they start the program, we are going to be programming immediately in the R programming language. We're going to be going over statistics, picking up from t-tests and ANOVA, going right into regression analysis. So I would say that if you've done these things and you're comfortable with that material, then I would encourage you to apply. But if you feel like you need a little bit more training, some students are really looking forward to being in the program and they self-study in order to get themselves to a place where they're ready for the program. And other students might want to hold off on applying or maybe apply to a different degree program. One of the ones that's really popular for those that have medical experience or biology experience and want to learn about data analysis is applied biostatistics and epidemiology. And for those that are a little bit more mathematically inclined, the biostatistics master's degree program. So there are other options within our department.
Okay, another question after that. My English score is 1275. Can I apply for your master program?
The University of Southern California imposes restrictions on this for us. And Corinne, I think that students have to have at least is it a 90?
90 on the IBT.
Yeah. Okay, no problem. So dear audiences, please know that the minimum English requirement for our program is 90. But if you are really interested in public health science, you could also apply from pre-master's program. Thank you. Okay.
Oh, yes.
Yes, okay. Next question from live streaming platforms. Yeah, this question is about the health data science and compare with other data science area? What are the unique challenges and opportunities for us, for students?
Within public health data science?
Yeah.
I would say that the unique opportunities, especially at USC, is that we are located as we are a department of public health that is located within a school of public health. Or sorry, not a school of public health, a school of medicine, the Keck School of Medicine. So being within a school of medicine gives us opportunities for research and opportunities to apply the degree program to different disciplines within medicine and public health. So I think that that's an asset for being in this particular program. As far as challenges, I'd have to think on that a little bit more.
And I'd also just like to plug that our departments, because we are the largest department within the Keck School of Medicine, we offer many in-person and virtual seminars, events, and we're always promoting networking opportunities for students, whether it's with other graduate students on our campus, the UPC campus, in addition to, making connections with faculty. And I always recommend to students, while you're in school, make the most of those opportunities, whether it's just academic or even a professional sense. If there's something that you don't know, feel free to ask, like, where can I get more information or resources on maybe the specific research topic that you may be interested in? And also, who do you recommend that I speak to next? And that's the way how you build your network.
Thank you so much, Corinne. Okay, we just mentioned a lot about the computer skills, and we got another question from the Zoom. I think it's really important. Hi, Professor. Is it recommended to have some public health background for this program?
I would say recommended, yeah. Is it necessary though? No, surprisingly, no. I would think that as far as having a particular background, it's more important that you have a little bit of programming experience and the statistics background in order to come into the program. That said, we do like having students that are passionate about wanting to get this degree and passionate about wanting to apply data science to public health. So we see that if you have a public health background, maybe you can speak as to how that background has affected you, what you've learned in that background that's made you who you are today. But as far as it being necessary or highly recommended, I would say that's not.
Okay, thank you, Doctor. Hi, Professor. Will you offer an internship or job advising for your students? Thank you.
Oh, internships. Yes. One of the things that we frequently see is students come into the program and they immediately want to start with an internship. And we can help try to facilitate internships. But a lot of the times, people who are looking for interns want to see that the students have some skills within data science before taking them on. So I would say as you come in, don't expect to have an internship the very first semester you come in, but keep your eyes and ears out, because once you get into your second semester or the summer semester after your first year, that's when you'll be able to start doing internships, whether it's internships at external companies. We've seen that, and we have a specific mechanism by which we can have you intern at a company. Or you can do internships within our school or our department. And we've seen that people that do internships within our particular department or Keck School of Medicine, it is valuable for them. And one of the people that I had listed, who's now a biostatistician, had done an internship with somebody in our department. So it's a valuable experience and it can lead to a job later down the line.
Thank you so much. That's great to know that. Okay, next question from live streaming platforms. Hi, Professor, you just mentioned a lot of data science skills in your slides, for example, SQL, Python, GitHub, and this audience would like to know which computing skill is must have for our public health data science students.
Must have in order to apply for the program?
Yeah.
Just familiarity with programming in general. You'll learn R your very first semester in the program, and having some experience with programming either in R or in a different language will be helpful. I would say that if you had to have some kind of computing experience, that R is definitely useful. Python is useful as well. And I think that if you know Python, then it's a lot easier to learn R and pick it up. But it's not a necessity coming in.
Okay, thank you, Professor. Well, I got a really interesting question from platforms. The audiences ask that some people are worried about data may expose personal privacy. How do you see the correlation between public health data and personal privacy?
That's a great question. And when I was showing earlier in the presentation about how you make your way up the data scientist ladder, this is a great question for somebody that is becoming a policymaker within a particular institution or company to address. How do you make these database systems safe and secure? Obviously, all the data that you're going to be working with in the program, you won't have these issues that you have to deal with. But if you're working with medical data, things of that nature later on, you will have to worry about privacy issues. It's definitely more of a consideration when we're talking about things like electronic medical records or other health data. And knowing how these database systems work and knowing about how you can improve them, I think is going to be very valuable as far as being able to keep people's data private and secure. So that's not so much of an analysis of data question per se, it's like a database systems management question. And that's something that you can focus on in the program if it's of interest to you.
Okay, thank you, Doctor. And another interesting question, under the COVID and post-COVID era, has our major and project to show a positive effect or impact? And while our curriculums make some adjustment to the current environment?
Can you repeat that?
Under the COVID and post-COVID era, has our major show a positive effect to our current environment, and how about our curriculums to make some adjustment to adjust to the current environment?
Oh yeah, I think that the COVID pandemic, definitely being able to describe what has happened during the COVID pandemic, talk about projections for what the future is going to look like after the pandemic. The COVID pandemic has really given us a lot to research. And we've seen, especially in our regular master's program, that the COVID pandemic spurred a lot more applications where people have been interested in public health as a result of this pandemic. So it's given us another area to research. It's given us a really large area to research. And just thinking of the projects I've been involved in the past 3 years or so, there have been quite a handful of them that have related to the COVID pandemic, whether it's looking at countrywide rates of COVID rates of infection and modeling that, modeling vaccination rates and seeing what affects vaccination rates in the state of California. Lots of different research topics as a result. And I think you'll also find, at least I do it in my classes, you'll find that other instructors incorporate these types of examples into the curriculum.
Okay, thank you. And another question from Zoom about our internship. And is our internship is CPT while students get paid?
Yeah, so I had said before that there's a mechanism in order to have an internship at an external company. And yes, this person knows that the internship mechanism is CPT. It stands for Curricular Practical Training,
Yeah.
and it enables international students to intern at a particular company outside of USC. One of the requirements for that is that students cannot get paid for that. That is a legal requirement. Correct me if I'm wrong, Corinne.
Well, for any internships, they first would need to be approved by Dr. Pickering. We would need to see a job description, and that description must relate to the degree program. So for example, if your job description is completely in a different area regarding, let's say, like English writing, for example, like that wouldn't be approved. But essentially, CPT is just authorization for F1 international students to be able to work on and off campus. And as far as paid internships, that typically is dependent on the nature of the internship itself. I've seen students who did receive paid internships, but again, some internships may not be paid, but that's all why it must be detailed in the job offer letter and also have the approval of the Office of International Services.
Okay, thank you, Doctor, and thank you, Corinne. Okay, another question from live streaming. Is our program a STEM program?
Yes, we are a STEM designated program, and upon completion, students are eligible to apply for OPT in addition to the 24-month OPT extension.
All of the programs that you see on this slide, biostatistics, data science, epidemiology, these are all STEM designated programs. We do have a regular master's in public health program in our department, and that particular program is not STEM designated. It's only the master's of science programs that you see on this page.
Okay, I got another question from live streaming platforms. You know, the AI technology are really hot and really popular these days. So the audiences asked, how can machine learning and AI technology be used to improve data analysis and the decision-making process in public health?
That is that is a question that somebody could write a master's thesis on. There's so many different ways, and that's something that we're actually grappling with as a department, which is what is artificial intelligence? What are these programs like ChatGPT going to do to data analysis? I personally think that these types of AI are really good tools to help us. It can make our job easier. It makes researching things a lot easier. You don't have to look through a bunch of different articles. It can help you synthesize information. But I don't think that it's going to take our jobs. I have asked it particular questions where I've expected a particular answer and I've seen that it didn't get them right. So these types of programs, artificial intelligence, ChatGPT, they always need a person to be able to validate what they say, make sure that the right questions are being asked and things like that. So I guess overall, I see them as a good tool to help increase productivity. And we'll see where that particular technology goes in the next couple of years.
Okay, thank you, Doctor. Okay, our webinar has already lasted for approximately nearly 1 hour. And for now, our live stream platforms already have nearly 6,000 views. Thank you so much.
That's amazing.
This is great.
Yeah, okay. Because of limited time, so I will choose the last 2 questions for our audiences. Okay, the last one. Last before the one, I'm impressed with it ranked 2nd in NIH research funding on population and public health. Do master students have any opportunities to join in any labs to gain research experience?
Yes, short answer is yes, they do. This degree program isn't as research intensive as our other master's degree programs. Our other master's degree programs require a thesis, which is original research that you'd be conducting. So if you're in the data science program, it's really up to you to determine how involved you want to be in the research process. You can go through the entire program not having done research with a particular faculty member, or you can seek out maybe an internship, maybe a part-time, some kind of part-time experience with a faculty member. We also have a mechanism where students are able to get course credit for doing research with faculty. If you're looking at our course schedule, it is PM 590. It's a class called Directed Research. And what that is it's an experience where you'll spend a semester just working with a faculty member on some kind of project. It's not guaranteed as an experience, but if there's a faculty that wants to have a student work with them, which typically you can find, then reach out to them and tell them that you want to work on whatever it is they're working on. And faculty really like it when people are interested in what they're doing. So if you say you're interested in what they're doing and can show that you're interested, then they might have you on one of those directed research assistantships.
Okay, another question, last question. Okay, sorry, let me check. The last question from web streaming platforms: in what ways can data science improve the efficiency and cost effectiveness of public health interventions and resource allocation?
In what ways can it improve interventions? I think the biggest way that data science can be used is that it can give us a way to analyze really large data sets. So traditional biostatistics, you're a little bit limited in the size, number of variables that you're examining. But with data science and things like advances in parallel computing, you're able to analyze these massive data sets. And so that's going to give you really large power to have these insights that you wouldn't normally have had. So I think it's just the ability to use big data to analyze a lot of things concurrently in order to gain conclusions.
Okay, thanks so much, Dr. Pickering, and thanks so much, Corinne. Okay, is there anything else you would like to add before we conclude? Maybe give some words or suggestions to our audiences and potential applicants. Thank you.
That's about it. We just appreciate everyone taking time out of their day to spend time with us to learn more about our program. Again, we do have numerous programs within the department, and applications for our Master of Science programs open soon on August 17th on sophis.org.
Mm-hmm.
And it was great being able to share all of this with everybody. There were some really good questions today, and I can see that we're really passionate about data science, and I hope to see that you apply in the near future.
Thanks so much. Thanks again. Thanks for joining us today and sharing so much useful information. And this is really a fantastic program that will get students well prepared to address the important questions in public health and biomedical sciences. Okay, dear audience, also thanks to your participation. If you still have any questions or further inquiries, we could look forward to next webinar. And the slides just shows the email info, or you could also go to our official website and locate the email address or numbers. And you are really invited to apply for our program, Public Health Data Science. Everyone, this will be the end of today's webinar. Thanks for joining UIC graduate program event today. We will continue to have this series of webinars to bring cutting-edge knowledge and insights to you. Thank you.